Hello, this is Eric Schlorff, CEO of SeaStar Medical. Welcome to the second in a series of Fireside Chats. These chats will feature an interview with a member of our management team discussing a specific topic of relevance to SeaStar Medical. Today, I'm joined by Tim Varacek, our Senior Vice President of Business and Commercial Operations, who is responsible for the launch of QUELIMMUNE in pediatrics as well as adults in the future. Before we begin, I would like to remind listeners that comments made during this discussion by management will include forward-looking statements within the meaning of federal securities laws. These forward-looking statements involve risks and uncertainties that could cause actual results to differ materially from any anticipated results. For a list and description of risks and uncertainties, please review SeaStar Medical's filings with the Securities and Exchange Commission at sec.gov. Furthermore, the content of this discussion contains information that is accurate only as of the date of this recording, February 27, 2025. SeaStar Medical undertakes no obligation to revise or update any statements to reflect events or circumstances except as required by law. Thank you for joining us, and thank you for sharing our vision of making our selective cytopheretic device, or SCD, therapy platform widely accessible to critically ill adults and children who are afflicted with life-threatening organ failure due to extreme, out-of-control inflammation. Before we begin today's interview with Tim, I want to provide some background on SeaStar Medical. We fight inflammation when it overreacts and begins to damage critical organs. Inflammation is essential to the healing process of critical organs. However, the overactivation of inflammatory cells, which can be triggered by many different bodily insults, such as trauma, surgery, or infection, can send the body into shock and cause severe damage to a variety of critical organs, such as the heart, lungs, and kidneys. This condition is called the cytokine storm, and it can result in severe organ damage and even death. A cytokine storm can continue long after the initial insult. SeaStar Medical's patented SCD is a unique and simple therapy to calm hyperinflammation and preserve the health of critical organs. Our SCD therapy has applicability in a variety of acute and chronic high-value indications. In December, we issued a press release that estimates the addressable U.S. market for our SCD ranging from $25 to $33 billion annually across 5 indications for which we have collected clinical data. You can find this release on our website at www.seastarmedical.com. Of note, the total addressable U.S. market in our highest priority indication, adult acute kidney injury, ranges from $4.7 to $6.3 billion annually. Let me introduce you to Tim Varacek, who joined in April 2024 and is leading the launch of QUELIMMUNE at SeaStar Medical. Tim, share your impressions on how QUELIMMUNE is being received at hospitals and how we are managing new site activations given the additional steps required with the humanitarian device exemption approval.
Thanks, Eric. And let me start by saying that even with the temporary requirement of the patient registry that each pediatric hospital must participate in to purchase and utilize QUELIMMUNE, it's been an amazing year where I've seen firsthand how QUELIMMUNE has saved patients' lives. So to characterize what we're dealing with and give our listeners a perspective, the patient population is made up of extremely fragile patients who present at a pediatric hospital in a very grave condition. When they're placed on QUELIMMUNE therapy, they're in the ICU receiving continuous renal replacement therapy, also known as CRRT, because their kidneys have stopped functioning and they are suffering from sepsis or septic-like condition. They may have other organs which are shutting down as well and are, generally speaking, critically ill. In short, these kids have a very poor prognosis and their mortality rate is greater than 50% when receiving the current best standard of care treatment, which is CRRT plus antibiotics. There is no other therapy or drug to help these patients. And we should just take a minute to let that sink in. I mean, the standard of care has a mortality rate greater than 50%, and that's worse than a coin flip. And that rate has not changed in decades. QUELIMMUNE therapy represents new hope for these children, their families, and the medical community. the clinical data for QUELIMMUNE that was reviewed by FDA in their decision to approve the product under a humanitarian device exemption, also known as an HDE, observed that almost 8 in 10 patients with pediatric acute kidney injury and sepsis survived with QUELIMMUNE therapy on board versus approximately 5 in 10 on the standard of care. That is a 60% observed higher survival rate. So let's take a minute to talk about how QUELIMMUNE works. The QUELIMMUNE cartridge clips directly into the existing CRRT circuit of the patient treated. Along with the cartridge, saline, citrate, and injectable calcium are utilized to provide regional anticoagulation and prevent clotting. As the patient's blood passes through the device, it actually neutralizes overactive immune cells that are causing organ damage and wreaking havoc within the patient's body. It's unlike any other therapy for these patients today. Unlike, for example, a cytokine-specific biologic therapy that blocks a receptor site or binds an inflammatory mediator, QUELIMMUNE works at the point of production of these inflammatory cytokines, the neutrophil and monocyte. A simple analogy to describe this difference is a running water faucet that fills a sink and overflows onto the floor. QUELIMMUNE therapy works by shutting the faucet off, the source of the water, versus a cytokine-specific biologic therapy that mops up the floor. The mechanism of how QUELIMMUNE works, we believe, results in disease-modifying therapy as it works upstream at the effector cell that is causing the destructive inflammatory response, also known as a cytokine storm. So let me emphasize disease-modifying, meaning we are at the source of the problem. This is very different from the current standard of care that involves CRRT to replace kidney function, which is a supportive therapy only and has no impact on the overall inflammatory response of the patient's body. I really think of QUELIMMUNE as a smart therapy, as well as it has no observed effect on normally functioning immune cells and therefore does not show evidence of an immunosuppressive effect. In short, QUELIMMUNE stops the body's cycle of hyperinflammation at the source and actually allows the body's own reparative system to step in and heal the damage rather than perpetuating it. So when you think about the attributes of QUELIMMUNE, it really does set up nicely for our conversations with patient care teams. There is a very strong desire for pediatric hospitals to bring QUELIMMUNE into their facilities. We have broad support within critical care, nephrology, and the skilled nursing and patient care teams that serve this extremely fragile patient population. And the excitement is growing. As with any launch in our industry, you typically start with the leading institutions and key opinion leaders that drive the therapeutic area. That's exactly what we have done at SeaStar Medical with the launch of our QUELIMMUNE disease-modifying therapy in pediatric AKI. This is a selective launch of QUELIMMUNE, focused on flagship pediatric treatment centers. While we are still in the early stage of our launch and post-approval patient surveillance registry requirement, we have already seen positive results in patient outcomes. One other item to mention on this topic is because the initial indication is rare and critical, in fact, at a few thousand patients, it is classified as orphan in size, which speaks to one of the criteria of receiving an HDE approval, specifically the criteria of fewer than 8,000 patients in the US. So doctors want to do everything possible to help the patient, and word is spreading based on premier pediatric hospital systems, such as Cincinnati Children's, that are treating patients and getting desired results. Because of that, we are seeing very strong commitment by these institutions and their physicians and patient care teams to bring QUELIMMUNE therapy into their hospitals.
Yeah, thanks, Tim. Let me ask you to further explain the commitment the hospital must have to bring QUELIMMUNE into their institution in this initial phase of launch. Maybe you can give the audience some more details on that.
Sure thing, Eric. For context, we are really in a very unique situation with QUELIMMUNE therapy. The approval under the HDE is rare. Essentially, the FDA looked at the clinical data already produced, and they basically say, okay, this looks safe for patients, and the potential benefits of QUELIMMUNE therapy are transformative and disease modifying. That said, there is still a need for more clinical outcomes data, so the process of bringing QUELIMMUNE therapy into a hospital requires a commitment to participate in the patient registry. The patient registry technically is a post-approval surveillance of a set number of patients that receive QUELIMMUNE therapy. Specifically, when an activated hospital site puts a patient on QUELIMMUNE therapy, they input into the registry a modest set of data on each patient. Things that would be observed in an initial workup of the patient and data that would already be collected as part of the standard care of that patient. Like the HDE, the patient registry requires approval from the hospital's internal review board, also known as an IRB. This added step, we found, increases the time it takes to activate the site so they can purchase and use QUELIMMUNE therapy. So there needs to be a strong desire by the treating physicians and patient care teams to champion QUELIMMUNE and shepherd it through the IRB process. And that's exactly what we're finding. The realization that QUELIMMUNE therapy can save lives, which is the ultimate motivation to have it available. With that background, let's discuss the rest of the process. We work directly with each site to complete a series of steps from initial signing of a confidential disclosure agreement to site activation and product adoption. Each hospital system does things a bit differently within the required regulatory framework, and we adjust to support them and complete the process as quickly and efficiently as possible. Ultimately, this boils down to the time to activation, and that can vary from a few months to 8 to 10 months. The time frame to activation is really a reflection of the HDE framework and setting up a patient registry at each site. We continually evolve our support of sites as we learn new things and discover efficiencies that we can carry forward. And one other thing before moving on, I'd like to give a bit more detail on an important aspect of the activation process, which is the internal review board approval of QUELIMMUNE therapy. Once the IRB approves QUELIMMUNE under the HDE, the site technically can purchase our product while they work through the rest of the activation of the registry. This is an important point because we don't know when the next patient is going to show up at the hospital. If that happens and the site wants to use QUELIMMUNE therapy, we will immediately provide skilled nursing support and training, and the site simply needs to talk to their IRB about emergency use of the device. This example has already presented itself multiple times within our customer base, and we were able to send QUELIMMUNE therapy overnight to the hospital and successfully treat patients. The FDA has been very clear that the patient registry should not be an impediment to treatment. They understand that a life could be at stake and QUELIMMUNE therapy could tip the scales in our favor. A final point is that as a company, we host a monthly clinical users meeting for treating physicians and patient care teams. The call is virtual and hosted by our Chief Medical Officer, Kevin Chung, and frankly, it's been fantastic. Each month, the audience grows as more and more institutions join the call. Many of them are inactive, but they've heard the news and they want to learn more. We listen to actual treating physicians discuss what they've encountered with a variety of patient profiles and the performance of QUELIMMUNE therapy. Physicians and patient care teams learn through this process and are able to ask questions and gain more knowledge on patient type and how to administer QUELIMMUNE therapy. In short, there is a lot of excitement about QUELIMMUNE therapy and how it promises to be a game changer in the treatment of pediatric AKI with sepsis.
Yeah, thanks, Tim. Can you share your perspectives on the trajectory of QUELIMMUNE therapy in our SCD technology?
Love to. This is a subject that I can wax poetically about. So just for some more context, we are at a starting point in pediatrics in a very fragile and critically ill group of kids, as already described. And thankfully, this is a small population. And the occurrence of pediatric AKI with sepsis is roughly several thousand per year. We want these children to grow up and have wonderful lives, and QUELIMMUNE therapy could improve the odds of that happening. Pediatric AKI is the best proving ground that we could have for QUELIMMUNE therapy, truly a win-win for patients and strong evidence that SeaStar Medical is providing therapy that is helping to save lives. To date, we have 5 active commercial sites that have purchased and used QUELIMMUNE therapy, with more on the way. As we work through the initial phase of adoption in this orphan indication, that includes the steps for IRB and patient registry, an appropriate performance metric in this early phase of launch is the number of sites that are in the queue to begin the adoption process. Specifically, we currently have 8 additional sites taking the QUELIMMUNE HDE and patient registry through their IRB, and approximately 25 more that we're engaged with. Ultimately, I really do have great confidence in QUELIMMUNE adoption over time in pediatric hospitals, notwithstanding the added timeline related to IRB approval and patient registry. Now, let's discuss the future, which looks very, very bright. We are currently engaged in a pivotal clinical trial in adult AKI called Neutralize AKI. This population is approximately 50 times the size of the pediatric population. We're actively enrolling patients, and we believe we will be in a position to complete enrollment this year with top-line data readout within 90 days post last patient treated. A rough development timeline for the potential launch of the adult indication could be in the second half of 2026. It's also important to highlight that the SCD has already received FDA breakthrough therapy designation in 4 different indications. And we are actively looking at additional potential breakthrough therapy indications. In the world that I've operated in for over 30 years in this industry, multiple breakthrough therapy designations for the same product are a rare occurrence. It speaks to the great potential of QUELIMMUNE therapy and almost endless possibilities for its application. We at SeaStar are very focused as well, and I have significant responsibility to critically evaluate each new potential indication to help determine the viability of it commercially upon an approval. Considering the commercial opportunity in terms of clinical outcomes, competition, market potential, pricing, and reimbursement flexibility. It's a deep evaluation, but one I very much enjoy. And ultimately, this all adds up to, in my opinion, a massive positive impact on patient mortality over time with the SCD therapy. There is no drug or device I have seen in my career with the level of observed outcomes data that the SCD therapy has produced. I believe we at SeaStar and the growing number of physicians and patient care teams studying the SCD therapy are changing the landscape of how to treat devastating hyperinflammatory conditions. In terms of commercial success, this translates to blockbuster revenue potential over time and great reward and success for all of our stakeholders. So once again, Eric, thanks for the opportunity to speak directly about QUELIMMUNE and our commercial opportunity. I really hope I was able to provide not just data, but the emotion behind the data. I am pumped up about SeaStar and QUELIMMUNE and our SCD platform, and I really love this company and what we're doing to save lives.
Well, thanks, Tim. So in closing, let me summarize why I'm so excited about SeaStar Medical's future. We have a proprietary technology that has shown significant benefit in life-threatening consequences of hyperinflammation. This is a major unmet clinical need, representing a multi-billion-dollar market opportunities. From a competitive standpoint, there is no other therapy commercially available that can modify the inflammatory process once it's triggered to help repair the cause and the damage caused by the cytokine storm. Our priority is to gain FDA clearance for the SCD and adult AKI. We also have data supporting the economic value of our technology to significantly reduce healthcare costs, which will facilitate our commercialization efforts. Our technology has potential applications in multiple acute and chronic high-value indications. We have identified 5 near-term indications and mapped out development programs that address markets with blockbuster potential. Thank you so much for attending this Fireside Chat today, and we hope that you will join us as we discuss another topic next month. Have a great day.